All right. Today we'll finally be concluding with our study that we started some days ago. Um, we had a couple of sessions learning and understanding growth. And for instance, I hope they have been useful as we have been tackling different cases so far. And we've actually talked about some specific diseases. And now today, I will mainly focus to answer to some questions that we did not fully address in the session that we had previously, of which I still remember the question that we mainly had. It was on the growth hormone deficiency. But before that, just a short review of the central thing actually about this growth is first as knowing the normal growth rates, especially from 3 years to puberty, since it's kind of a bit more regular, and that goes from 5 to 6.5 centimeter per year. When it becomes abnormal, or subnormal, in other words, it can go less than 5 centimeter per year. And usually when the height goes below the third percentile, we'll notice in most of short stature diseases and induced diseases, most of the children that were looking at their charts had like their height below the third percentile. And also potential, genetic diseases, actually, by calculating the mid-parental height, it will also help us to root them up. And then some major conditions, actually, or diseases that can mimic or that can be seen when the patient or the child is underweight for the height. We can start thinking about decreased nutritional intake, malabsorption, or even increased energy requirement. When actually the child is overweight for the height, this actually we can start thinking about endocrine disorders, of which yesterday we've talked about the growth hormone deficiency. And apart from that, there are some other disorders like hypothyroidism or cortisol excess. So this was basically a rule of thumb for growth that's try to summarize for us a different period of time, like the linear growth that's basically happened, starting first with the weight, how at birth, actually the first few days there is like a weight loss, and then it starts returning basically on the 7 to 10 days of age, and it gets to double by 4 to 5 months and triple by 1 year. In terms of height, we first have around 20 inches at birth, and that can go around 30 inches at 1 year. And then by 4 years, basically by 4 years, we can have already the double birth length. That's that has been basically given. Then, okay, in terms of head circumference, can go around 35, the average 35 centimeter at birth. And then we go increasing 1 centimeter per month for the first year. Apart from that, we also learned about the mid-parental height, the formula that also is different from, for boys and girls, and to help us to get the target height. And this has been quite handy and in many of cases that we have discussed about. One of the links that can help us to find different charts, growth charts, is by using the CDC link, and you can easily find updated and standardized growth charts over there. And we will define short stature as the height below the third percentile, and the extreme short stature more than 3 standard deviations from the mean. So this basically was the major things that we have learned about growth. Now we had some questions that's about the growth hormone that's pushed us to get to read some articles so that we can get to tackle them, and that's what I will try to share with you, and we can still go through together in terms of answering to those questions. So let me first start with I think it was this one. All right. So the question was about growth hormone, how we learned that some characteristics of a growth hormone deficiency, it can affect, there will be the microphallus, right? There will be the microphallus that can be noticed. And apart from, then the question was like, what is the link? Like, what is the link between growth hormone and the size of the penis? Like, shouldn't it be a sexual hormone actually? That's how to do that. So what is the link between growth hormone and sexual hormone? So that was one of the questions that you asked. So and yeah, so I had to look for some articles that are basically focusing on growth hormone deficiency and try to figure out to answer to that specific question. And then you also had a question about the what was it, chuberic appearance as well. In terms when it comes to growth hormone deficiency. So so far, while exploring some articles, there is this particular one. That is entitled congenital growth hormone, and in this specific one, something that would have learned, or something that we can learn first, is that it's telling us how growth hormone, the growth hormone deficiency is an important cause of short stature in childhood, and it's characterized by low growth velocity in childhood, mainly diagnosed by stimulation testing. Now, in this particular article, there is something interesting that has been mentioned, and the thing that has been mentioned is like, usually in growth hormone deficient patients, actually there have been specific cases that entails like a classic triad, and the classic triad is basically that there is it's something, there is the ectopic posterior pituitary that is affected, there is an aplastic anterior pituitary, as well as absent of thin pituitary stalk. So basically it's like a set of abnormalities that come along with a severe growth hormone deficiency. So where would that lead to us? As you will notice, as it has been basically said here, that patients with congenital hypopituitarism may have, this type of classic triad. And this is basically everything that it entails. So this specific, point will bring us to the part first where we need to understand, can I say, how it's likely that not only growth hormone stimulation can be affected in people who are having growth hormone deficiency, but there can be also other specific hormones that are still secreted basically into the anterior pituitary gland, or even the posterior one actually, that will also be affected. And one of them, as we're thinking about the gonadotropin hormone, basically, that also can likely as well be affected. But let me first focus in terms of growth hormone stimulation. So with the growth hormone specifically, it stimulates among the functions. There is the stimulation of it stimulates the production of insulin, the insulin-like growth factor. All right, and then there is also it affects growth and metabolism. Those basically are among the main functions. So one thing that we got first to know in terms of the clinical features of the growth hormone is that it will help to stimulate like linear growth, as we have noticed, increase the bone density and muscle strength. All right, that is something that will be actually already of help for us. And now, mostly people who are having the congenital growth hormone deficiency, they will tend to show like a deceleration, all right, of their linear growth. It can be normal at birth, but as they are going through infancy, as they are growing up, actually, like all throughout, as they keep growing up, they will have actually a deceleration, like that will be noticed. Now, one specific thing is this, as I've mentioned, how for growth hormone deficient patients, some actually will have this kind of triad. Well, it's not only growth hormone that's affected, but even the gonadotropin hormone that also becomes deficient. And thus, for males, actually, specifically, especially those who also have the gonadotropin deficiency, they might actually have a microphallus. However, the microphallus can even happen, without the gonadotropin deficiency. So this is first one thing that we can already, put or get to know. And then something else as well that was asked about the appearance is that usually with growth hormone deficient patients, they may appear chubby or have a cherubic facial appearance. Cherubic facial appearance, so it just basically, as we notice, the maxilla at the maxilla level, it just appears like kind of swollen. It just appears kind of swollen at that area. And okay, they still add with flat nasal bridge and mid-face hypoplasia. This is first one information that you can get, as in the the growth hormone deficiency can also be can go along with a gonadotropin deficiency that can actually present with microcephalus. Though there are also situations where there is no gonadotropin deficiency, but still there is the presence of microcephalus. Now, this is first one thing that was pointed in this article. But furthermore, in this other specific one that has been entitled "Effects of Growth Hormone on Adult Human Gonads and the Action on the Reproduction and Sexual Function," So in this one, it has helped us to even give a bit more clarity on some important things. All right, here we go. First, in terms of puberty, all right, like right at this place here. Let me just enlight it. So it has been reported that the growth hormone is a significant promoter of the onset of puberty, and it has a vital effect on sexual maturation in all mammalian species. So first, we need to know how the growth hormone actually also have effects on sexual maturation. Like for instance, the activation of the gonadotropin releasing hormone pulse generator at the pubertal onset. This basically triggers the hormone cascades for essential sexual maturation and related body mass and nutritional states, right? This is one of effects that it can all have. Now, there is something also that has been said here, how the puberty pattern of pituitary gonadotropin secretion is established, and the growth hormone can promote the puberty development. So it's still again for us to understand how the growth hormone can basically play a role into puberty. So in situations of some people actually who have been sick of the Laron dwarfism, okay, these people are basically insensitive, or these patients are insensitive to the growth hormone, and they have been found with a delayed puberty. So this is an example, for example, of to show us how like insensitivity to growth hormone can also provoke or cause like a delayed puberty. Still, again, to give us some facts to show how the growth hormone actually plays a role in terms of sexual maturation. So there is even a specific evidence here that we can also get to know is how the growth hormone gene expression has been found within the human testes. And here are, a couple of them that have been studied, but I will currently first not go in details. Like we have a couple of these genes, where they are produced and where they have been found. Like for example, the growth hormone N is secreted from the pituitary gland and has been detected in the human testis. The V, all right, all of these, all of these are specific examples that we can also know about it. So something that we can at least understand, let me look for the graph through all of it, is first the production of the growth hormone will kind of stimulate, all right, the secretion of the insulin growth factor from the liver. So they help each other. It plays a role into the secretion of this growth factor. And now, as they get produced, so together hand in hand, basically will be reaching the testes. Okay, will basically reach that. It will have an impact on it, or an effect on the testes, and this will basically improve the action or the stimulation, as well as the development into the testis environment that will be with the FSH, as well the Sertoli cell. Okay, they get affected over to ameliorate basically the sperm development environment. And still again, they promote as well the level of production of testosterone. So even though it's still like a specific, can I say, mechanism that's not complete and fully yet entirely mature in terms of complete knowledge, but there's so far have been proven, the impact of the growth hormone over the testes and how basically it helps even in amelioration of the sperm development and in that specific environment. All right, so there is furthermore things that we can learn and even read and and get to understand further. But so far, I would like first to know if it's clear at this point first.
Yeah.
Okay, so at this point you can understand how the growth hormone helps or also plays a role into the sexual maturation, right? I mean, do you?
And please show me again. Which part?
I mean, do you at least at this point understand how that the growth hormone also plays a role into the sexual maturation development?
I mean, the growth hormone from the pituitary gland and the liver, anterior pituitary and the liver, both to growth hormone and then testosterone.
Okay, is this clear? Or there's still like something, a part that is unclear, or a question?
The cell?
May you repeat again?
And the hormone and they're both in the same body, even boys and girls.
Oh, okay, good. This is an example for boys, actually, how it affects, but there is also the specific one for girls. But yes, both actually, like in both genders, yeah. But this is specifically for boys.
Oh, about the picture, can you repeat again about this one?
Okay, all right. So, like the growth hormone is stimulated from the anterior pituitary gland, all right? Now, when it's stimulated, it will have effect over the liver. When it's by the effect of the liver is to stimulate the secretion of the insulin growth factor 1. Right? So now, as the insulin growth factor 1 is stimulated, so together with the growth hormone will have an effect on the testes. The effect that they will have on the testes is that they will again stimulate the secretion, the local secretion of growth hormone with insulin growth factor 1 together.
Together? Right. How?
Yeah. So, like for instance, in the testes, the cells, once they get, like for example, there is the systemic secretion, all right? The systemic secretion, it means it's the one that has been secreted from the pituitary and the liver, all right? So these two, I mean, these together will go to the testes. As they reach the testes, there will be basically a production of the same hormone now from the testes, okay, locally.
Same hormone?
Yeah, the growth hormone and insulin growth factor. It will also be produced locally.
Locally?
Yes.
Okay.
And now, as it's produced locally, it will help, actually, now the production of it locally, it will now help for the FSH. Okay. The FSH, it will help the FSH together with the FSH, all of them together will help. They will help now. They will, they will put help for the cells, okay, the Sertoli cells, where rely the sperm and everything, actually, to create a good, a nice environment, a propice environment for the sperm to develop well, for the good development of sperms.
Oh.
Yeah. So it means in case there is a problem with growth hormone, it will cause a problem with insulin growth factor. And altogether, will also cause a problem actually with the good development of the sperm. The sperm. Yeah. So this is how basically growth hormone. One of ways that growth hormone also plays a role into the sexual development.
Oh, then growth hormone is not enough. Then we should say, like, because for boys testosterone is not enough, then puberty development is not good. But FSH is for boys. Is it get lower?
Oh no, even girls as well. For follicular stimulating hormone, not only for boys. Genders, both genders.
For boys, only for boy. This picture is for boy, right?
Yeah. Yes.
This picture for boy. Then we can say, because growth hormone not enough from pituitary and the liver, and then stimulate the testes, and then both FSH and getting lower or getting reduced.
Yes. No, it doesn't affect the, how can I say, the production of FSH, but it comes together. So together to work together with FSH for bettering the environment.
It doesn't affect the FSH.
Yeah, FSH is produced there, right? FSH we have it on as well, production into the pituitary gland. But now they work together to make a better environment. So it means, in case, for example, in case there is a deficiency of growth hormone, let's say FSH can still be stimulated, but now it will be missing, you know, and then it will not, there will not be a good environment for the sperm development.
Oh, okay. So both of them got low, so couldn't produce sperm, and testosterone also low.
Yes, low. Yeah.
Okay, good.
Yeah. So that's yeah, that's actually, since yesterday we're talking about the boy, right? Having the microphallus. Yeah.
Oh, okay.
So then that's the major thing that I wanted to discuss today. It was for us to find out the link between growth hormone and sexual function.
This is different from hypogonadism, right?
Okay, good point. So now, as in the case that I've mentioned here, that there are actually situations whereby the person will not only have growth hormone deficiency, he will also have actually a long hypogonadism or gonadotropin deficiency. So they can also come together. They can also happen together, actually. But this one, specifically this one, just what we are talking here, it's only about the growth hormone. Yeah.
But for hypogonadism, we still can use this picture, right? Then it should be like from the pituitary, all of them are deficiency.
Exactly. Yes, all of them. FSH will be affected. LH, all of them actually will be affected from there on. Yeah, and then provoke. I mean, what we have just seen among, I mean, one of the presentations that we saw.
Okay.
Good. Is there any other question?
How other thing you showed? Other article?
Or this one? Okay, this one is kind of focusing on the MRI as well, like to show, how it looks, you know, in terms of growth hormone deficiency, especially when it's linked with the triad, you know. I mean, like the MRI for the pituitary gland examination. I mean, checkup.
Oh.
Yeah. So it's also adding that. Yeah.
Okay.
Fantastic. Yeah. So then we've answered to the question, and that's already something important and key to us. All right. So if there's no any other question, then now we'll conclude with our current study, and we shall again share our next topic, something that we shall dive in. Yeah, soon enough. So thank you already for your patience.